Hi class, my name is Erica and the disease that I research is Bordetella pertussis. Etiological agent: Bordetella pertussis, causes of epidemic pertussis and the usual cause of sporadic pertussis. Bordetella parapertussis is the occasional cause of sporadic pertussis. Bordetella homesi, bacteremia in immunocompromised hosts. Bordetella bronchii septica is common in animal pathogen. Reservoir: it is a human disease, no animal or insect source, no vector known to exist, and Bordetella pertussis is very contagious. Morphology and features of pertussis: it is a small gram-negative coccobacillus. It is obligately aerobic, non-motile, and fastidious. Virulence factors and mechanism of infection: virulent strains possesses a capsule. The bacteria attach only to ciliated cells in the trachea, and pertussis produces many toxins. And the first toxin is pertussis toxin, and it contributes to bacterial binding of cilia and causes lymphocytosis and impairs chemotaxis, and it enters the bloodstream. The next is adenylate cyclase toxin, and it inhibits phagocyte and NK cell functions. Tracheocytoxin, and it inhibits DNA synthesis and promotes cell death, and it is responsible for damage of ciliated cells. And the last is filamentose, hemagglutinin, and pertactin, and it attaches to the epithelial cells. These toxins are poisons which cause damage to cilia and the airway to swell. This produces the coughing. Pertussis is primarily a toxin-mediated disease. Pertussis can lead to bacterial pneumonia. Bordetella pertussis is also known as pertussis, or whooping cough is usually the common name. Pertussis is an acute infectious disease caused by bacterium Bordetella pertussis. Pertussis is derived from the Latin word per, which means thoroughly, and tossis, meaning cough. It is primarily found in children and can be life-threatening for babies under a year old. Signs and symptoms. There is clinically 3 stages of pertussis. The first stage is catarrhal. It is early symptoms that can last for 1 to 2 weeks, and it usually includes a runny or stuffy nose, low-grade fever, mild, occasional cough, apnea, which is life-threatening pauses in breathing, and cyanosis is when you turn blue or purple, and this is common in babies and young children. In its early stages, whooping cough appears to be nothing more than a common cold. Therefore, doctors often do not suspect or diagnose it until more severe symptoms appear. Stage 2 is paroxysmal, and 1 to 2 weeks after the first symptoms start, people with whooping cough may develop paroxysms, which is rapid, violent, and uncontrolled coughing fits. These coughing fits usually last 1 to 6 weeks, but it can last up to 10 weeks. Coughing fits generally get worse and become more common as illness continues. Coughing fits can cause people to make high-pitched whoop sound when they are finally able to inhale at the end of a coughing fit. Vomit can occur, and you may feel very tired after the fit, but usually seem well in between these coughing fits. And sometimes people struggle to breathe when they have these coughing fits. Stage 3 is called convalescent, and it is a recovery from whooping cough. Can be slow. The cough becomes milder and less common as you get better. Coughing fits may stop for a while but can return if you get other respiratory infections. Coughing fits can return many months after the whooping cough illness started. Transmission, it spreads easily from person to person, which is direct contact. Person who is infected coughs or sneezes. They release small particles with bacteria, which is via droplets, contact with contamination formites. Pertussis is primarily found in children. People can be contagious for weeks and can spread the bacteria from the very first symptom and for at least 2 weeks after the coughing begins. People can have mild symptoms or people who don't know that have whooping cough can still spread the bacteria to others. Treatment. It's best to treat pertussis during the first week to 2 weeks before coughing occurs. Early treatment is most effective for reducing symptom severity. Treatment is ineffective if it started late in the illness. Hospitalization is common, especially for infants less than 6 months old. Respiratory support such as supplemental oxygen or even mechanical ventilation may be necessary for severe disease. Antimicrobial are given for treatment for individuals with confirmed or highly suspected. Antibiotics do not alter the course of the illness or prevent transmission if they're given later in the course of illness. Antibiotics that are given are azithromycin, clarithromycin, and erythromycin. It is recommended to get plenty of rest, drink lots of fluids, stay hydrated, and take antibiotics as needed. Lab diagnosis. To detect whooping cough, there are tests that can be done. A sample can be collected from a person's throat or nasal to have it cultured. The first is a PCR test, which you get the results immediately, but it varies in the specifics of the testing. Second test is a culture. It is sent to the lab, but the results take 7 days, and it has better specificity. Blood tests can be drawn and sent to the lab to check for white blood cell count. White blood cell count help the body fight infections such as whooping cough. A high white count usually indicates the presence of a type of infection. Blood test is not specific for whooping cough, but it is a general test. X-rays can be taken to check for the presence of fluid in the lungs or inflammation. This can occur when pneumonia complicates whooping cough. Prevention. The best way for prevention is to get vaccinated. There are vaccines available for babies, children, and adults. Babies and young children get their first dose of vaccine between the ages of 2 months, 4 months, 6 months, and between 15 to 18 months and 4 to 6 years of age. Total of 5 shots. Younger children get diphtheria, tetanus, and pertussis, which is known as DTaP. Older children aged 11 and 12 years old get a single dose of tetanus, diphtheria, pertussis, and that is a Tdap. Adults aged 19 through 64 years of age get a booster of Tdap every 10 years. Pregnant women are now recommended to receive the vaccine between 27 and 36 weeks gestation, and this may help protect the infant during the first few months of life. Cover your mouth and nose when coughing or sneezing. Wash your hands with soap and water often. If soap or water is not available, it's recommended to use a hand sanitizer. Immunity. Pertussis has 2 vaccines available, the DTaP and Tdap. These vaccines both can protect against diphtheria, tetanus, and pertussis. The vaccine contributes to an active immunity by providing us with a controlled way to create an immune response. Humans produce active immunity created by our own immune system when we are exposed through innate immunity or vaccine-induced immunity. Some fun facts. Pertussis is known as whooping cough because of the whooping sound that people can make when gasping for air after a fit of coughing. And there's more that you can read over. Multiple choice questions. What are the modes of transmission of pertussis? At what age can you get your first vaccine? And what is the most infective stage of pertussis? Thank you for listening, and this is Pertussis.